So the issue we've got with this.
So we came to the Invisalign clinic last night, and today we do problem.
Just the onboarding systems here.
Once again, I want to say thank you for all
The video and go through that old and new.
Okay.
I'm not here as often as I can, but I'm trying my best. I think it's slightly better.
Okay, then I'll just ask you when I need to grab your laptop to actually talk about system-specific stuff. Cool.
But what the issue is when you get in here, right? Chip loop, blah, blah, and it's fine, implant neck. There's a couple of things that I don't understand on this, which is that one's fine, the impression that's okay. Let's see. This one here, this is a video, micro motion flat matching. Do you know what that? And that
Just skip past it. It's fine.
Sure, so yep. I mean, but then what we've got here.
And we just want to make sure that the in-house we've got some.
So this is surgical C design, so it goes through the drill protocol here. But then it's kind of, this shows a 3.3, we've got 4.5, so it shows what to do, but basically private drill. And that's pretty much the drill protocol.
Figure it out. Just figure it out. Cool. I'll just call you when I need to grab it.
And if we've got time, we've got some bone grafting material as well. We've got some tools here as well. If we've got time, we can have a play with that as well. But we'll see how time goes. We've got dinner arranged later on tonight if you have time to join us. If not, that's okay. That's a weekend. I know you guys are busy as well. And just a bit of a forecast. What's next? We've got Invisalign coming in to talk about how to use that scanning protocol and see how we can do that to exam more, so we can utilize the scanner a bit more. And secondly, we have Hancho, a specialist orchard. He promised to come in September to give his talk. And we got Josh, of the doctors, Ellie from Australia. They're coming back to see their family. At the same time, they come and present. I think the topic will be on 3 alignments as well. David from Christchurch, David Gold, and he's coming, as he said, he's willing to come up to Auckland and give us a talk on, and he's very good with his grafting and a lot of soft tissue management as well. And hopefully, in the future, it's pretty full up for this year. I hope next year we can continue this. We get every 2 months with the in-house training and then the social care. Because I know different people want to do that. And it's good to hang out and we meet each other off the clinic sort of thing. But let's start the evening tonight. I want to introduce our key speakers tonight. First of all, Dee, you want to come forward? We'll give it a big round of applause. We've known Dee for a long time. I mean, we've known each other for something like 7, 8 years. Yep. And he started from Nobel and then Austin, and now he's a commercial director in Strongman Group, Australia and New Zealand as well. And he's the key business coordinator or the director. So looking after big groups like Abanos and hopefully small group like that's found into as well. And tonight we've got Nick here as well. Nick is the implant specialist and also the sales rep for the implant and the Clear Correct as well. So let's put our hands together for Nick. And we also thank you for bringing on the machine. Some of them are shipped from Australia and all the kids here just to make this evenings happen. So I'll pass this down to
Awesome. Dee. Thank you. Do I need to, I don't think I need to use this, right? You guys can all hear me clearly? Yeah, all good? Okay, then I can pass that back down. Awesome, I'm hooked up here. Sure. Kind of frees up a hand. I've got a tendency to talk with my hands a wee bit. Good evening, ladies and gentlemen. Thank you all for joining us this evening. Before I get started, let me just try and move this out the way before I fall over, before I even get started. If you guys have any questions, please ask as we go along. There's nothing worse than me just standing and talking and everyone staring at me. So please ask questions as we go. Who of you in the room are actively placing implants at the moment? Yeah, like very shy couple of hands out there, and obviously all of you, I assume, have restored implants before? Yep, okay, and is there anyone that hasn't heard of Straumann Group? No one, fantastic. Okay, so I'll just briefly run you guys through a bit of the history of Straumann, our company, the products that Straumann Group own and that lives under the Straumann Group umbrella. I'll give you a brief overview into some of the historic Straumann implant systems that you might see out on the market, and then we'll kind of progress through the evening into the newer generation of Straumann implants that you guys will be placing in Smile Dental going forward. We've got some hands-on time later on where you can drill into the bone blocks and then also into some of the immediacy models. So Straumann Group was founded in 1954. We are a global implant company, and if you look at global implant market share, we are the largest dental implant company globally. We have around 35% global implant market share, and that lives between the different implant brands that Straumann own that I'll show you guys in some of the following slide. We've got more than 8,000 employees worldwide, and our products are present in more than 100 countries around the world. Our ANZ head office is based out of Melbourne, our APAC head office is based out of Singapore, and then our global headquarters is based out of Basel in Switzerland. All of our products are manufactured in Switzerland. We do have a separate manufacturing facility that is been set up within the Chinese market. We've had exponential growth within the Chinese market over the past 3 years, to the point that we actually had to set up a dedicated manufacturing plant for China only. So we do global manufacturing for all international markets out of Switzerland and China for China only. That might be part of a big reason. So a lot of you guys might be aware of the fact that obviously within the Chinese market, within oral healthcare, it's all within the public tender and within the public hospital space. Straumann was awarded the public hospital or private healthcare or public healthcare space tender within the Chinese market. And therefore we've had a massive knock-on effect of patients being treated both in public and then also in private. So you might find more and more of your Chinese patients being aware of the Straumann implant name and actually coming into clinic asking for the product by name. We've seen this across multiple different countries around the world where consumers are becoming more and more aware of what is going into their bodies. So a lot of times before they come to you guys and seek treatment, they might actually go online, do a bit of a Google search, ChatGPT, any of the other search engines that are available to them. And if you go online and you search biggest dental implant brand or best dental implant brand, Straumann Group is always the company that comes up first. So just be aware of that. That's why you might actually find that, is there anyone that places implant, has anyone had a patient in the past that have actually come in and asked for a Straumann implant? Or asked you, what implant are you placing and do you place Straumann? Has anyone had that? Jackie, your hand's going up. I know Boris had a case recently where the patient came in and demanded it. We had a case the other day where a clinic that's brand new to us rang up and said, hey, I've got a patient demanding a Straumann implant. I think at the moment with consumer spending going downwards and people being more aware of what treatments are costing them, people are doing more research to find out whatever's going into their bodies actually has longevity and has the science to back up what the dentist is doing. So a brief overview of the evolution of the implant industry and then also the Straumann material and what makes Straumann different. So Jackie asked me the question earlier, obviously as he mentioned, I've worked at Nobel Biocare, I've worked at Ostem, I work at Straumann. Why do I work at Straumann? And then what are the actual key differences? Now for me, if you ask me, is a certain brand good or bad? I'll never tell you that another implant brand is bad. I can tell you in my honest opinion, I think if you shop within the top 10 implant companies globally, I don't think you're going to find a bad implant out there. But what defines being a bad or a good implant? And I think as a clinician, that's a question you have to ask yourself. Is it predominantly, in your opinion, is it based around commercials? Is it based around cost? Does that define what a good or a bad product is? Is it about the clinical treatment outcomes that you have with your patients? Does that define good or bad? And then what implicates and impacts the treatment outcomes that you're getting and the predictability thereof. And that's where Straumann has a multitude of very unique selling points on our products, which is part of the reason why a Straumann implant will cost you a bit more than what you will have with some other of the more economic systems out there. Within we always talk about premium, challenger, and eco implant brand segments. So eco being truly geared at low entry point, developing implant markets. That's normally where your eco brands are quite strong. Your challenger section are the brands that challenge the premium companies. If we talk about premium, we talk about the old European companies that started off the implant industries. So your Straumanns, your Nobel Biocares, your Biomed 3i, obviously they are American, your Astras, etc. So key differences. If you look up there, there's something called rock solid. Now, all implants are manufactured, as we know, of grade 4 titanium predominantly. Grade 4 surgical grade titanium is the most frequently used material to manufacture a dental implant from. However, when you look at that, they say that yes, obviously grade 4 is the best integration from a titanium point of view. What we found through clinical research is that when you combine zirconium with titanium, it's actually more biocompatible to the human body. Your integration rate and then also long-term success rate of the implant increases exponentially. So that's why our manufacturing material of choice is 85% grade 4 titanium with 15% zirconium. Zirconium is not only more biocompatible, but it's also stronger than what you have in only pure grade 4 titanium. What a lot of the challenger or echo implant brands out there do, and unfortunately it happens a lot of times without them even making the clinician aware, is they add titanium alloy to the manufacturing process of their implants. The reason why they add titanium alloy is obviously a harder metal than what titanium or grade 4 titanium is. Therefore, it makes the implant stronger and it makes it a lower risk implant to actually fracture. But unfortunately, titanium alloy is one of the most non-biocompatible or lowest biocompatibility ratio materials that you can insert into the human body. So just think about that. The brands that you work with, do a bit of research. Make sure that, for example, your smaller implants don't actually have titanium alloy in without you actually even being aware of it, because it is very common within the echo segment of the market or the challenger segment of the market. Okay. That's rock solid in the primary differences in the material that we use to manufacture our implants. We also do have a full zirconia implant lineup available within Straumann at present. Sorry, good. I'm just checking if what's on my phone is going up on screen as well. Our zirconium implant lineup, due to manufacturing of our ceramics, has changed. We have discontinued our Straumann ceramic implant portfolio. They are redesigning them and we will relaunch them at a later stage. Straumann Group owns another company by the name of Neodent, which you might have heard of in the past. Neodent still has a ceramic implant lineup currently available. So if you ever have a patient that comes in and says that they demand a pure ceramic or zirconia implant, we do have one available, just not presently within the Straumann portfolio. We're basically using out the rest of the stock that we have, of which there's very, very little throughout the rest of the world, and then thereafter relaunching the brand at a later stage. If you guys have any questions about materials or anything as I go, please stop me. So that's pretty much what we've just talked through. So implant surfaces. So Straumann implant surface, since around, I think we started with SL Active around 2005, but our key technology on our implant surface is what we call SLA, so sandblast large grit acid etching of our implant surface. If you go throughout the implant industry, pretty much I'd say 98% of all implants that are manufactured using this manufacturing or treatment process on the implant surface. So everyone has copied what we started with SLA. The only different company that has their own manufacturing methodology is Nobel Biocare, who anodize their implants. So it's a totally different process of manufacturing the implant surface. They believe that there's some key advantages for them in that. We have got a heap of studies to prove the contrary. So, you know, it's up to you as a clinician to make up your mind after reading those trials and publications that are available as to what implant surface you use. But this is pretty much the gold standard within the implant industry. We launched SL Active, the middle implant over there, which has got the same surface treatment protocol. The only difference in that is it has got our SL Active solution that the implant is suspended in. What the implant does is it enables faster healing times and faster loading protocols for you as clinician to be applied. Benefit of fasting loaded protocols is, for example, on an SLA implant, we recommend time to loading is 8 to 10 weeks, whereas with an SL Active implant, we have data on file to prove you can load that implant as early as week 6. So if you think about it, what is the relevance thereof for your patient is you can go from treatment to time to teeth in half the time that you can with another implant brand that's out there. So it gives you a distinct differentiator to sell your treatment plans to your patients. I'm not saying you have to go to faster time to teeth. You can still follow the basic SAC protocols within ITI methodology and go to a slower restoration rate, but you do know that you are working with an implant that has been proven to integrate faster. The other big benefit of the implant surface is that your drop-off ratio from mechanical to biological stability formation is substantially lower. So in that high-risk period when you've done an implant, especially on a compromised side, if you've got a healed ridge where there's no, it's not compromised, normally your success rate should be pretty high. But when you start progressing in your career and you start doing more advanced treatments like immediates, you've got a large bone graft and a defect that you need to fill up, that is where the drop-off ratio between mechanical to biological stability formation becomes a key element in the treatment process. Using an implant like SL Active, which Jackie has decided to get for you guys as a group, gives you again a distinct advantage as clinician, knowing that this implant, if the implant fails, because any implant can fail, but if the implant fails, myself as the clinician, I did everything I could to give my patient the best treatment outcome. Right. And then there's just the ZLA, or our ceramic implant, and the surface thereof. However, as I say, that has been discontinued for time being. Here they just talk about what SL Active on an implant surface is. One of the key things that I have not mentioned, and one of the other advantages of the SL Active treatment on the surface, is it also reduces the risk of carbon adhesion onto your implant surface. Have any of you guys ever heard within implant, or not just implant, dental implants, but orthopedic implants, about the terminology of carbon adhesion and why they try and reduce the risk of carbon adhesion? Anyone familiar with that? No one. So in orthopedic surgery, that's why they usually place their implants within a negative pressure room. So it's just the risk of carbon being actually adhered to titanium. So titanium will attract carbon to adhere onto the surface. And when you place it, there's a higher risk of compromised healing and slower clot formation. So a key differentiator, Jackie asked me, versus the current implant systems that you guys are using, which obviously I used to sell to you in the past, what are the differences with the surface? Those 2 or 3 key points that I've just mentioned, those are your primary advantages. You know that you are literally with Straumann SL Active using the most tested and most studied implant surface to give your patient the best chance to a successful treatment outcome. That's it. Here's what I was talking about in regards to faster time of healing. So obviously with any implant, we are trying to achieve a high primary stability through mechanical adhesion in bone when you place it. Have any of you guys ever seen a patient at 1 week or 2 week review and done a ISQ test again at that point in time? What you'll normally find, if you do an ISQ test at time of surgery, you'll get a fairly high reading, and when you start seeing that patient between week 2 to 4, you'll normally have a drop-off period, and then biological stability formation will start occurring and it will start elevating and peaking again. So by using SL Active, you decrease and you move that window earlier on where the drop-off occurs, minimizing your chance of early implant failure due to lack of integration and formation of new bone around the implant surface. There's just, again, just having a look at, obviously under microscope, SEM microscope, what that would look like. This is what I was talking about in regards to a higher bone to implant contact and better osseointegration. And here they just talk about the curve again that we just went through. So the evolution of the Straumann implant system. So we are the company that started the tissue level implant concept within implant treatment. Have any of you ever placed a tissue level implant? No one? Okay. So tissue level implants are a phenomenal solution when you have a patient that has pre-existing perio and oral healthcare issues, and you know that that implant, the maintenance thereof, could be compromised. Tissue level implants basically take your restoration from bone level to tissue level. Is it perfect for every indication? No. That is why we have a bone level lineup. There's a lot of places where you do need a bone level implant, and for certain treatment protocols, a bone level implant will be a better solution. However, tissue level solutions are picking up popularity again in sites where previously they might not have been used. So for example, in the posterior of the mouth, to have a really large base that you can build your restoration on. Another place where they've become more and more popular is within the posterior maxilla, especially when you start your implant journey and you're not really that confident to do a large internal or crestal sinus lift, and not even to mention about a large lateral sinus lift. A lot of clinicians start placing shorter and shorter and shorter implants to reduce the procedure of doing a sinus lift for the patient. If you think about a bone level implant of 6 mils in length, and you then have to try and do a 6, 7, 8 mil crown on top of that, you start your prosthetic protocols and principles of maintaining a 1-to-1 ratio start going out the window. When you use a 6 mil tissue level implant, you will still have 6 mils of metal within bone, and then a 2 mil support structure within the soft tissue. So all of a sudden you've got an 8 mil implant essentially that you are working on rather than a 6 mil implant. Does that make sense what I just said to everyone? It's a really big advantage of tissue level implants within the posterior maxillary zone when you are trying to avoid a bone graft for the patient. From far left to right, we obviously had our S and then our SP implant. So that is just in regards to the actual height of that tissue collar. So the shorter one, the SP, that's a 1.8mm machine collar. The S is a 2.8mm machine collar. Then we had NNC. Obviously, again, if you start thinking where that would be used, that could be used in the anterior of the mouth. Then we had the TE profile, which had a wider neck for the posterior, and then the widest neck that you see on your right, that was in our more aggressive implant designs to the right. So you can kind of see how they have gradually progressed from very low or non-aggressive implants far left all the way to your more aggressive implant types that you see in the middle, and then within the bone level, third from right up there. That's called, middle one there, sorry, this is called a BL implant. I don't know why I'm pointing at it. That's a BL. We realized with BL that it's a great surgical solution, but we needed something more aggressive to get higher rates of primary stability from the mechanical adhesion or integration into bone during that early loading stage. Then we developed the BLT, and then we have transgressed all the way down to a BLX design, and we now have a new implant called BLC that some of you will be placing tonight. Sorry, we did not have enough of every single implant type, so what we've done is we've broken them up between BLX and then BLC, and then you'll also have TLX, TLC. But they kind of spread across the room, so we'll just see what everyone has to work on. Just going through that. Why we have moved away from this previous connections that we had in Straumann. So when me and Jackie decided as to what implant system to introduce into Smile Dental, we obviously had some of the older generation implants like the BL or the BLT that I was showing you, and then we have our newer connections. And one of the primary reasons we decided to go for the newer generation of implant is Jackie said to me that he would rather use and get you guys geared up in Smile Dental with what the best connection is that we have, and then also from a digital integration piece, what the implant is that will be best for you to use going forward, looking at digital dentistry and the evolution thereof, and what we can provide through digital technology from Straumann. That is why we decided to go for, it's mentioned here at the bottom, but BLX, TLX, and then BLC, TLC. The connection type on that is called torque fit, as opposed to these diameters that you see up here. That was for our older implant systems, and that was called CrossFit. Okay, so I'm not going to focus on anything legacy or historic so much tonight. I'll rather talk about the newer generation of implant designs that's on a secondary presentation that I'll throw up for you guys. Here's just to give you a visual of what the tissue level solution would look like in the mouth. From a restorative point of view, also quite simplistic, where you know that you don't have to have an issue where you are trying to take an impression at bone level, where you could potentially have bone impingement on your impression coping or your scan body, or then tissue interference with the seating of your restorative abutment. This abutment that is a one piece actually lives within the soft tissue almost to equicrest, and your restoration and impression that you'll be taking, you'll take at tissue level, and then your restoration will just be built on top of that. So it gives you a fairly simplistic solution from a restorative point of view as well. From a healing point of view, and if you think of bacterial accumulation and potential risk of peri-implantitis, you're also removing or actually moving the micro gap from bone level all the way up to tissue level. So you are reducing risk of bacterial infiltration into this micro gap area. I'll show you with our bone level design, that's another thing where Straumann is truly unique, is how we reduce the risk of bacterial micropenetration or micro seepage through your implant abutment interface on our bone level solution. So obviously just platform switch design, I'm not going to go into that too much, and I'll move over into this. So BLX, TLX, I'm not going to focus on the implant right now. I'll rather get the secondary presentation up because then I can do a comparison for you between X and C-line implants. Size-wise, we'll cover that off in our second presentation. One of the key benefits of BLX and BLC, so our X and C-line implants, is that you are working on a one connection size implant, from 3.5 diameter implant all the way through to 6.5. So simplicity is what you will have from a surgical perspective and from a restorative standpoint as well, because you are reducing the amount of inventory that you need in clinic. So if you're doing impressions, do most of you guys do intraoral scans for your implant impressions, or do most of you still do analog? Intraoral scanning? So you would need one scan body for any implant size that you are placing. There's no different connection sizes. that. I think I'm not going to go into ceramic implants too much. I don't think we need to focus too much on diagnostics and planning. What I'll say to you guys about diagnostics and planning is Straumann also has, do any of you guys do your own implant planning, or does the lab do that for you? Who takes care or ownership of the implant planning?
Both, really.
Both?
Yeah.
Both? And that's for freehand and guided? Okay. And software-wise, what do you guys use?
Well, we just got the CBCT machine.
Okay.
Yeah.
So you'll use your CT implant planning software that's integrated into whatever CT scan you guys have in clinic for all of you. Okay. As part of what we did when we signed up the contract with Smile Dental is, so Straumann Group owns Dental Wings, so we have our own implant planning software called Co-Diagnostics. So Co-Diagnostics is compatible, firstly I'll say it's compatible with any implant brand out there. If they've given the libraries to us, it will be on Co-Diagnostics. But Co-Diagnostics is far more than just an implant planning software. So once you've taken your CT scan, you can upload it into Co-Diagnostics. We have a cloud-based platform with an umbrella called Access or AXS that you can sign up with for free. You just use your Smile Dental account when registered on eShop to log into the account. Your Co-Diagnostics implant planning software lives up there. So essentially when you take intraoral scan and CT scan, the files are automatically uploaded and imported into the planning software. You can do your provisional implant planning. If you want to do guide design, you can do that yourself as well. But excuse me. Sorry, I've been struggling the whole day. I'm losing my voice at like middle of the day. You can do your own implant planning, and then you can export to the laboratory to produce your surgical guide. Oh, thank you, Jackie. Thank you very much. Thank you. The lab can then go and produce surgical guide for you if you're doing a guided treatment. But why I say it's not just an implant planning software is, as you start advancing and you start doing more advanced treatments, Co-Diagnostics gives you the ability to plan stuff like bone reduction guides. So when you do a full arch treatment and you need to do an alveolectomy, you can actually design a stackable guide that lives on your primary surgical guide. So you'll do a bone reduction guide, then you'll do an implant placement guide, and then you can even design a prosthetic fitment guide of your temporary prosthesis that you can deliver chairside at time of surgery. So it gives you the ability to do far more than just basic implant planning. You can do bone harvesting guides. So if you look at all the advanced stuff that a lot of the specialists are doing nowadays, obviously they're Curie techniques or ridge splitting techniques that they are doing. You can actually design a bone harvesting guide where you harvest a plate from the ramus, you build a scaffold that gets attached to the ridge, and you actually position your plate that you want to tack onto the rest of the arch with a guide rather than having to try and do it free-handed. So it's far more than just implant planning. We are also developing a new software that integrates into Co-Diagnostics called Co-Diagnostics Copilot. What we are trying to do is give clinicians the ability to improve their implant plans or treatment plan acceptance rates. So what it will be is you'll take a CT scan for your patient's in the chair, you take an intraoral scan. By the time the patient is done with surgery, or sorry, not done with surgery, done with their scan, and your nurse is still sucking saliva out the mouth, AI generates a surgical treatment plan for you. It generates a surgical guide treatment plan for you, and it puts a prosthetic tooth in place on the patient's own arch that you can show them on your scanner screen to show them what they're going to look like with the treatment that you're trying to provide for them. So just trying to give you more resources, more tools to actually be a better clinician with a higher acceptance rates of the treatments that you're trying to implement and do in clinic. That is integratable with any intraoral scanner. It's not Straumann specific. Obviously we have the Straumann Sirius intraoral scanner, which is our own scanner that you guys have to your availability at a heavily discounted rate if you ever want one. But it's also integratable with stuff like 3Shape. Most other intraoral scanners you can. The only difference is the way that the file makes itself onto the platform. If it's a Straumann scanner, it's directly integrated. If it's a competitor brand implant scan or an intraoral scanner, you just have to import STL into the software. So just the connection and flow is a little bit different. There's just a bit more on Co-Diagnostics, just what your surgical guide process looks like. The nice thing with Co-Diagnostics, it always gives you can't really see it here, but bottom right, it always gives you an actual drilling protocol as well. So you'll get back from the lab when they've completed your surgical guide plan, you'll get back either digitally or printed out a piece of paper that looks like that with the exact drilling protocol based on the type of bone density that was found on your CT scan. And obviously that's very helpful when you are transitioning from one implant brand to another. You're not really used to how the implant feels in bone. You're not really 100% sure about the drilling protocol. That gives you access to it. I'm not going to go through much. Yeah, and this stuff is irrelevant. Nick, can I grab your laptop because then we can jump into the newer stuff, mate? Is there any questions up until this point? No? No one?
Why you can use single platform with a 3.5 sort of platform to a 6.0 or whatever? What makes it different with the design that compared to like Straumann or Nobel? I mean, Nobel or Austin, we need
Yep.
a different regular narrow. Yeah.
Yep. So there's a couple of different things. Sorry. I'll pull this out. Let me just, sorry, Jackie, give me 1 second. Let me just get this out. Like that in, and then that fella. So there's a couple of things. So the reason why most companies have multiple different implant connection sizes, there's a couple of factors that impact that. One of the factors will be you have to, based on the material that we manufacture our implants from, we don't need to alter the internal screw channel and the width of the screw channel and the connection point between abutment and implant, so your implant abutment interface. We don't need to alter the size of that connection to make a smaller diameter implant stronger. Because what you'll see if you look at CTs of a lot of your implants that you've done in the past, I actually, funnily enough, had a look at one the other day that you posted on socials. If you look at the coronal implant wall thickness, you will see that your internal abutment channel narrows for a narrower implant because they're trying to widen or thicken the coronal implant wall to reduce the risk of fracture on the implant coronally, which increases exponentially over time with constant occlusion, and obviously if that implant is placed off axis, increases again. That is because they predominantly are made of grade 4 titanium, or then as I said, grade 4 titanium with titanium alloy added. When you have zirconium added to the implant, you don't need to decrease the size of that internal abutment connection channel because you don't need to worry about making the implant wall thicker because it is inherently a stronger material. So that's why we can have a single implant or implant connection size from 3.5 all the way to 6.5. How we essentially on our restorative platform combat that is we give you the, how can I put this, the downside of that. If you have a single connection size, so let's say for a 3.5 implant, your abutment connection size is 3.0. If you still have a 3.0 connection on your 6.5 implant, sorry, it's actually on here later on that I could show you, but if you have a 6.5 diameter with a 3.0 internal connection, what you're going to end up having is a crown that looks like a lollipop. Yep, so like you're showing there in the back. However, what we have done is we've changed the internal connecting point of our restorative abutment. So depending on, so you'll see the term RBWB on Straumann single connection implant sizes. When we talk about RBWB, RB is in reference to the size of the restorative abutment diameter where it connects to the implant, and also the connection point changes because of that change in diameter of the base. So the internal connection remains the same, but where the actual abutment engages in the connection changes. So for a 3.5, it obviously has to engage more internally. For a wider platform implant, so a WB implant with the same platform size, it connects further outward coronally, higher up within the connection point. So then you have, for a narrow implant, a gradual flare within the emergence, and for a wider implant, you have a more gradual flare mimicking a natural tooth structure as well. So we've counted that because exactly what you were saying, if we have the same connection, we're going to have lollipops in the posterior of the mouth, which you don't want to have. So using a WB healing abutment and a WB restorative abutment changes the connection point of it and how that restoration will look. But I'll show you that in a sec. So this is the Access platform that I was referring to earlier on. You guys will see top left Access. So what Access is, essentially we talk about capture, engage, planning, design, produce, treat, and monitor. And how we're going to be doing that going forward, obviously from a capturing point of view, we do it through the Straumann Sirius intraoral scanner. From an engagement point of view, Straumann Group also own a business called SmileCloud, which you guys would have probably all heard of. I don't know, has any one of you seen the new AI video, 3D video generation available on SmileCloud? It's been all over socials the past 2 days. We are the first engagement app out there that actually gives you a visual illustration, not just on a photo, but actually with patient motion in a 3D video to sell your treatment plan to patient. So not just for implant treatment, but also for any other aesthetic or cosmetic dental treatment that you are doing. You scan your patient, AI generates a 3D video for you of the patient's smile that you can then tweak and manage from there on out, but to show your patient what they will look like. One point I just want to mention that I forgot to mention on co-diagnostics, which is here, the next piece. So part of the contract for Smile Dental is that each and every one of you who place implants have access to co-diagnostics at an 89% discount. The 11%, all that covers, you basically have access to it for free. The only thing that is payable annually is your annual subscription, which is about $500. So that 11%, that equates to about $500 that you need to pay annually to have access to the software. Within the laboratory, we would need to give them Co-Diagnostics Producer, but then you can design on Co-Diagnostics Client, and they can produce for you on Co-Diagnostics Producer. So that is all part of the contract that has been signed with Smile Dental. You all have access to that. You just need to notify Nick that you would like the software. We will have a dongle sent out. We have a full digital team in Australia who can do training for you, so they can take you through CT importation, iOS importation, planning, guide production, anything that you want to do on the software, we can facilitate. So we're not just going to give you the software and then run away. We will actually train you on it as well. Okay. There's a service called Smile in a Box, which is, if you look under the planning puzzle piece, Smile in a Box is our own restorative, but also guide fabrication and design software facility that we have. So we can produce for you surgical guides as well. Obviously, you guys have the ability through the laboratory to produce guides for yourselves. But if you ever do, when you start transitioning in your implant journey, you start doing more advanced stuff, we can, through Smile in a Box, give you a surgical guide, a prosthetic fitment guide, as well as 10 teeth to be delivered at time of surgery. We will also, however, going forward, if you look within the design and then the produce stage, design is our Smile in a Box, but Straumann Nova. So Nova is your CAD/CAM integrated restorative design solutions. And then you will see Smile in a Box and 3D printers. So Straumann Group is launching in collaboration with SprintRay. We've got a global partnership with them where they've manufactured a unit for us called the Straumann Signature Midas. You guys might have seen or heard of the Midas previously. It was the first 50% zirconia press print chairside 3D printer. They have, however, integrated new and unique workflows around Straumann Group product only, where you can either on an anterior implant go to temp solution within 7 minutes chairside. So through Smile Cloud, visualization and planning to produce under the production stage with a Straumann Signature Midas, 7 minutes to patient leaving with a temp tooth in the mouth out the clinic. Okay. So again, there's no more building it up on a temp cylinder. It takes you 45 to 60 minutes chairside. So essentially what we're trying to do, and you'll see as we talk about these digital puzzle pieces, we're trying to free up clinical time for you guys to actually spend time seeing more patients, treating more patients more effectively with more predictable treatment outcomes over a longer period and duration of your careers. iExcel, that will be the product portfolio within treatment that we'll be talking about tonight. They mentioned Falcon here. Falcon will be our robotic implant placement device, so 3D or dynamic navigation for implant treatment and placement. Unique is again restorative workflows, and then GalvoSurge for treatment of peri-implantitis. So instead of doing the old conventional treatments, obviously we have GalvoSurge where you can actually treat a patient with an implant that has peri-implantitis on, and get that implant to a natural pierced state as it was at time of production through a non-surgically invasive procedure, if I can call it such. So you don't have to grab a high-speed burn, actually polish that implant to remove any bacterial biofilm adhesion to the surface. You can do it via electrical current and an IO that gets attached to your implant body. And then implant registry far right, just for patient monitoring. I mean, you guys all know what your patient charts look like with multiple stickers on them on anything that's ever been used in their mouths. For any implant that you place in Straumann, once you scan it, so you will have access to a scanner where you can scan your barcode online, on screen, and once you've scanned it, it registers your patient for you, as well as what implant, what healing abutment was used for treatment. So you always have access to your implant registry and any implant that's historically been placed. The nice thing about that is you think about traveling patients. You might have patients coming from here and going back, a mum or dad visiting their kids here, going back to wherever they live permanently, and then you get multiple phone calls and emails and text messages what implant has been placed. You can direct them to the implant registry online, and they can go and find the implant for retreatment wherever the patient lives or have moved to. So just simplifying things. This is just what the digital pieces look like. So I've spoken about them, but visually, Smile Cloud, Co-Diagnostics, the Smile in a Box service and solution through Straumann that I was referring to, the Falcon digital implant treatment navigation device. Obviously, these are our implant scanners. Virtuo Vivo has been discontinued, so it should actually not be on there. Allied Star is the company who manufactures the Sirius intraoral scanner for us. So they don't just manufacture them for us. We actually own Allied Star. So we've acquired Allied Star a couple of years ago, and they've developed the Sirius intraoral scanner for us. Sorry. Straumann Unique, we also have a milling facility. So for your laboratory, Jackie, that's actually something I wanted to mention to, what's his name that I met earlier? Yeah, regarding Straumann Unique, so milling of custom solutions, whether it be custom single abutments, whether it be for full arch cases where you need bars and stuff milled, we can mill, so he can do it design through CAD, export to them, mill and produce, and he does the restorative work on top. So with your zirconia or your wraparound acrylic that you use, and then there's just what your implant registry would look like. Galvo Surge is this unit here, bottom right, and then just again a couple of more digital pieces. Not going to talk through this, we've spoken about that a lot. And is that going to play? How do I play this? Sorry, say again, how do I play this? No. Someone else. Let me just see if I can get this to play. Nick, is yours touch screen or no? No. No, okay. Okay, there's supposed to be a really nice video here that's supposed to come up, but unfortunately it doesn't seem like that's going to work. What is? Jackie, sorry, I don't have that on here. How do I get out of this screen?
It's on your projector.
No, it's not on here. Oh, that's on the projector? Sorry. Is there a screen? Sorry, I've got no idea what happened there.
Is it a screensaver?
No, that's, I don't know. No, it's not on mine, so I don't know what that is.
Is that from the projector?
It seems it.
Sorry, so much.
Any questions?
What's the prevalence for tissue level implants these days? Is training for tissue level implants has a reduction occurred?
It's interesting. So the prevalence of tissue level implants decreased exponentially when the market shifted to bone level a couple of years back. However, we are gradually seeing that, sorry, I'll leave you with that and I'll talk over here. We're gradually seeing certain fragments of the market progressing back to tissue level. And I think it's also, one of the big reasons why they're becoming more popular is one of the disadvantages of the old tissue level solution was the implant shape. I mean, if you look at that first implant shape I had up far left, it was like a blunted apex, non-aggressive threads. It's going to be a challenging implant in a challenging case to get the stability that you're after. But now that you have tissue level implants available in any implant type for any clinical indication from the same manufacturer, you can go and base it on clinical indication of the type of bone you are treating with, then look at patient soft tissue health and how you want to manage the soft tissue around the implant and decide, am I using a bone level or a tissue level without compromising the clinical placement and outcome of the implant. So we are seeing within certain markets a move back to tissue level. What the exact percentages of that are, I'll lie to you if I give you an exact percentage, but we're definitely seeing a higher adoption rate of tissue level implants again. Within perio, a lot of the perios are still very inclined to have tissue level within their arsenal. I'd say within perio, it's probably about 40-60 for tissue level versus bone level. Within oral surgery or oral maxillofacial surgery, I think that ratio is far more weight towards bone level implants, but that's just also due to the nature of the speciality and how those guys normally manage their cases. The perios are known to obviously be a lot more concerned about peri-implant soft tissue health.
Why do oral surgeons prefer
Bone level implant, sorry, that was the next part of the sentence that I wanted to say, where the one looks more about peri-implant soft tissues, the other one looks more about mechanical stability that they get through the implant, which is based on previous implant designs that you had available in tissue level. And I think also the complexity of some of the placements. I think a lot of times your oral surgeons, your maxillofacial surgeons, they are the guys that are willing to take on the really complex stuff, where very often you need a bone level implant. So if you think about in a full arch rehabilitation restorative space, that's a place where, for example, you can't, if you don't have sufficient restorative space, you can't use a tissue level implant, because then at the end of the day, your bridge that you're restoring in the mouth gets too thin and you can't actually get retention on it. So, and obviously risk of breakage goes up. But if you use a bone level implant alongside alveolectomy and you flatten the ridge, then a bone level solution is better than a tissue level solution. So I think it's also got to do with the cases and how they manage them. On immediates, and you've got a massive jump gap, that really wide osteotomy on a 6 or a 7 that you've exoed, a lot of times a bone level solution can be placed significantly subcrestally. A lot of the new bone or bone level designs are placed as deep as 2-3 mil subcrestal with some of the new teaching philosophies that are coming out on like zero bone loss concepts and stuff like that from Thomas Linkter-Victus. That what they're trying to do is get the implant deeper with a narrower internal connection with no bone interference, and then for less bone remodeling to take place in the long term moving forward. But the really important part of that process is also your restoration goes on top of that implant when you've placed it like that. Because if you don't have the correct angulations from a restorative point of view, you will have exponential bone loss potentially around the implant, and the maintenance becomes very challenging going from there. So I think it's just predominantly the cases that the guys are dealing with, and why the one looks a bit more at tissue and the other one, where's the bone, how do I get the implant in, and how do I actually get the stability for my referring dentist to be able to restore the implant in a fashion that's suitable for the referrer and also for the patient.
Sorry, just
Yeah, no.